So this is cervical orthosis, and there are many different types of these on the market. This is our own particular brand that we redesigned in AutoCAD, and it has a certain fulcrum and leverage onto the neck. And the idea is to restore the cervical curve by stretching the anterior ligaments of the spine. And so they call this Denerol is a brand that makes something very similar to this, and we're just going to call it a cervical orthotic block. And so, or the ACC block. And so this part that sticks forward, which is not in normal ones, actually comes up against the shoulders. It helps stabilize the shoulder to create more leverage against the cervical spine. So I'm going to show you how to use this. First of all, you got to find the right size. We have 2 sizes, and soon we'll have 3 sizes, or maybe even 4. But it's either the larger one or the smaller one. The larger one's usually for Caucasians or people with very flexible necks. The smaller one's for people with very rigid necks or people with very small necks. So we sit down and lie back, and you place the Denerol block, or the cervical block, under the neck. And the first one is going to be very close to the lower part of the spine. Now, most people will simply just rest on this. In the beginning, you may want to do that if you're very symptomatic. The idea is to actually use the neck muscles to begin to actually stretch the ligaments in the front. And there's actually 2 motions. One motion is lifting the chin, one motion is pushing backwards. And you do those motions at the same time. You lift the chin and push backwards at the same time over the block. And the idea is that you mold the neck around the block. So you take, the first thing you do is you start to lift the chin, push back, and try to touch the floor, and try to squeeze the block between the shoulders and the neck. So hold it, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. And you do it again. You lift the chin and push backwards, so push all the way back to my head touches. And when I do this, I can feel a lot of pressure on the back of my neck, but I can also touch my head to the floor and to the back of the cervical block at the same time. And the part in the front holds the block firm. And if the patient does this, they should get up afterwards, and the neck should actually feel more loose. And over a period of time, it'll begin to restore the cervical curve. Okay, that's good. Okay, now this block can also be used, go ahead and start it again. The block can also be used for the thoracic spine if somebody has hyperkyphosis. So what they can do is they can actually put the block here, bring up the spine, the arms like this, and actually stretch over the block just as they would a foam roller. But the advantage of the block is it's much more focal, and it also doesn't move. So they're able to focus right on the apex of the hyperkyphosis. And this can also be done with weights if you want to really go after it. So they can actually take a couple of small weights, or even one of these kettlebells, and you can actually begin to get the body up and begin to work the spine back up into extension. Okay? Right, that's done.